Does hydration prevent heart attack and stroke? Actually, there's been a lot of buzz on the internet that it does. And some of that buzz is credited to Dr. Virend Somer at Mayo Clinic. So you start hearing all that and you start thinking, maybe it's got some credibility. At first, one of my viewers, Dr. Stones, pointed this out. And if you look at the comments section on my videos, you'll see that. Thank you, Dr. Stones. Again, very astute pickup. My first read on that was, maybe it was some outdated information. Maybe it was Mayo Clinic has sometimes used some information rental sources, medical information services, which sometimes put maybe hackneyed stuff that's not the greatest. And it's clearly not, often not Mayo Clinic cutting edge work. But that wasn't the case. We'll talk about what actually happened in just a minute. First of all, let me introduce myself. Dr. Ford Brewer, F-O-R-D, B-R-E-W-E-R, PrevMed, heart attack, stroke, cancer, disability prevention. So as you start looking around, you start seeing a lot of stuff on it. Like Dr. Stone said, Google Virend Somer, S-O-M-E-R, Mayo Clinic, hydration, heart attack. You'll start seeing a lot of stuff. One of the things you'll see is from the Huffington Post. This is a story about a high-end real estate professional, Tim Dahl, 56 years old, had a heart attack. And he put some of his information about his heart attack. He shared it on social media, and he started getting a lot of advice. One of the pieces of advice was stay hydrated. In fact, I'll show some of the details on what it was. Heart attacks and water. How many folks do you say don't drink anything before they go to bed so they won't have to get up and go to the bathroom? Well, it's very important from a cardiac specialist. 2 glasses of water after waking up, 1 glass of water 30 minutes before a meal, 1 glass before taking a bath, and 1 glass of water before going to bed avoids stroke and urine. Oh, sorry, you can't see that well. 1 glass of water before going to bed avoids stroke and not urine, avoids heart attack, does not avoid having to get up and urinate. Dr. Virend Somer is a cardiologist from the Mayo Clinic, published an article in JACC, the Journal of the American College of Cardiology, in July 2008. I looked at that article. I didn't really see anything like that in there. And it goes on to say most heart attacks occur between 6 a.m. and noon, and being hydrated will prevent it. So, like I said, so where's this coming from? Actually, the internet picked it up. This is Dr. I think his name is Mandell with MotivationslDoc. He did a video on this, espousing, let's get hydrated, drink water, and maybe water at night so we don't have a heart attack. If you start looking around, you'll start seeing some debunking sites like Snopes, Water Wheel, drinking 4 glasses of water at the beginning of each day will not cure all sorts of diseases. And it goes on to talk specifically about this one perception on the internet. So another thing you'll find, and this is what I think happened, I think there was some misinterpretation of a few things. Actually, even the Mayo Clinic came out with a statement. There were also statements, along with this hydration and water thing at night, there were statements about taking aspirin, and like keep an aspirin at your bedside. It included mention of Dr. Virend Somer's Mayo Clinic. Dr. Somers is at the Mayo Clinic, but neither Dr. Somers nor the Mayo Clinic contributed to an email chain that was going around talking about aspirin and hydration at night. So there may be something there. I certainly couldn't find it. Yes, I do recommend aspirin for folks that have plaque. That's a different issue, and it's baby aspirin, a totally different concern. I don't recommend drinking 1 or 2 glasses of water before you go to bed. I do recommend staying hydrated, but I don't think hydration is going to keep you from having a heart attack. I'm far more worried about inflammation, and we've talked multiple times about the root causes of inflammation. About 3/4 of it, glucose metabolism problems. Other things like Lp(a). Despite everybody's concern about cholesterol, LDL does cause it, but in the minority of people. By far the majority has to do with insulin resistance or diabetes. So if anybody knows anything that I'm not covering on this issue, please comment, let me know. I'll be very interested to hear about it. Thank you.